Good morning, and I want to welcome everyone to our Capitol Hill, Kaiser Permanente Capitol Hill Medical Center. I'm Ruth Williams Brinkley, and I am the president of Kaiser Permanente. I want to let you know how proud we are to have been selected as a vaccine distribution center in Washington, D.C. This is what we do. We take care of the community, and we are very pleased to do that. I want to start by thanking our D.C. Mayor, Mayor Muriel Bowser. I want to thank Dr. LaQuandra Nesbitt. I want to thank our fire chief, Chief John Donnelly. I want to also thank Dr. Robert Holman for his partnership. We are proud to partner with D.C. to bring these important vaccinations to the community. And I want to also, and very importantly, recognize the sacrifices of our healthcare workers, of our firefighters, and everyone working on the front line of this pandemic. It is our honor to provide this vaccine to our frontline healthcare workers, and I am ready to get my vaccine when the time comes. I will wait my turn. I want to note that Kaiser Permanente's commitment to health, and specifically the health of our community, is long-standing and enduring. Health to us is more than medical care. Medical care is important, but health is also what you eat and where you live. COVID-19 has really shown us the disparities that impact our communities. And Kaiser Permanente has been, and will be committed to addressing these disparities so that we can all live our lives, we can thrive, and access the American dream. It's important to know that this vaccine is critical to our work to fight the pandemic, and that the vaccine was developed following science. Speed did not sacrifice science. We must help those who are unsure about this vaccine to recognize its safety, its importance in helping us in this pandemic, so that we can return to the things that we all love to do. We can't do it right now, but eventually we will be. In the meantime, we must stay safe. We must remain vigilant by wearing our mask, by social distancing, and avoiding large gatherings and washing our hands. We know that the holidays are going to be difficult because we are social people. We like to get together. We like to get together with those we love. But we also know that this year, staying home is the best way to show your love for your family, your friends, and those you care about. So we can all come together in the future thanks to the sacrifices we are making today. I want to thank you for being here, and now I would like to introduce D.C. Mayor Muriel Bowser.
Well, good morning, everybody. I'm delighted to be here with you this morning. I want to thank Ruth Williams Brinkley for inviting us to Kaiser Permanente at Capitol Hill, part of the Mid-Atlantic region. And I want to publicly congratulate and welcome you, Ruth. I know you're in a relatively new position here, coming, I think, from another place in the company to lead this Mid-Atlantic region. You will know that I'm very familiar with Kaiser Permanente in the Mid-Atlantic. And we are very grateful that you focus on helping DC residents thrive and live wonderful lives. I'm also very excited to be here with my team, who is doing a really, I just can't tell you how much of a great job that they're doing in keeping DC residents safe throughout our response to this pandemic. I want to acknowledge Dr. LaQuandra Nesbitt and give her a big round of applause. Dr. Nesbitt is our doctor, Ruth, and she is responsible for leading DC Health, but also presenting to our communities and our entire government how we can have healthy people in DC. And you're so right in saying that that includes health care, but it includes everything that impacts our community's well-being. Let me also publicly congratulate for the first time time, our Chief of the Fire and EMS Department, John Donnelly. Give John a big round of applause. He received his confirmation from the council this week, and we couldn't be prouder of that. Dr. Holman, who leads our EMS, he's the medical director for Fire and EMS, and has been also very ahead of keeping firefighters throughout this COVID response safe and on the job and well for their families too. So that's my team, and I know there's a huge Kaiser Permanente team that's going to help make this delivery possible. We've come and we're all a little tired of COVID, right? But we can't get too tired of it because we have to crush it, and we're going to need the next few months to do that. And part of that is everybody getting a vaccine when it's their turn. And Dr. Nesbitt has been working hand in hand with our federal partners to make sure that we're ready here in D.C. She has outlined in detail the distribution plan for vaccine in D.C., and Kaiser Permanente is one of our 6 partners that's helping to get the vaccine distributed. And more than that, they are going to be, I think, the primary or maybe the only location for DC Fire and EMS to schedule their appointments and come in and be tested. So today, I think we have a few volunteers who are going to show everybody why it's so important to get the vaccine. We're in phase 1A of our distribution, and as you know, that covers healthcare workers. And that's about 80,000 people. Dr. Nesbitt has secured a partnership with the states of Maryland and Virginia to also share some of their vaccine so that we're not just focused on DC residents who are healthcare workers, but everybody who comes to our city to support healthcare. And we're very grateful to them for that partnership. So now I'm going to get out of the way. I think that I get to introduce Dr. LaQuandra Nesbitt, who'll say a bit more, followed by Chief Donnelly, and then we'll get on to the vaccinations, and I'll be available for questions in another room.
Thank you, Madam Mayor, and thank you so much for your leadership over the past several months that we've been responding to the pandemic here in Washington, D.C. And I also want to extend a huge thanks to Ms. Williams-Brinkley for her leadership here at Kaiser Permanente. I've had the benefit of knowing Ruth for quite some time, and the partnership that we have with Kaiser Permanente Mid-Atlantic is exactly what we expect under her leadership, to be able to extend this opportunity to serve the community in such a wonderful way, and to open up its network and to be able to serve as a site for vaccinating our first responders and our frontline public health workers. It's such an amazing opportunity that during this first week that the COVID-19 vaccine is available nationwide, that we're able to take care of our first responders who have been providing pre-hospital care since the beginning of this pandemic, to be able to allow them to have access to a vaccine that can confer protection to our population from this disease. We, back in the spring, under the leadership of Mayor Bowser, convened a reopening DC advisory group. And so much of what we discussed is what would it look like, or what would it take for us to get back to our pre-COVID days, to be able to get back to all of those things that we value in our community, in terms of our overall values, in terms of what our economy looked like, in terms of what it would take for us to get back to a place where we were still vigilant about our overall health and well-being, but we could walk around our communities in ways that we were doing this time last year. And so much of that centered around having a vaccine available. But having a vaccine available is not the end game. It's getting vaccinated that is the end game. And so what we're doing here today is expressing to you all what we believe to be a safe and effective vaccine, that when it's your turn to get vaccinated, we want you to have confidence in the vaccine. I have had many discussions with members of my team that say to me, people want to know what Dr. Nesbitt's going to do. Well, Dr. Nesbitt's going to get vaccinated. Dr. Nesbitt has confidence in the vaccine. Dr. Nesbitt has confidence in the processes that exist in the U.S. That allow only products that are safe and effective for the American people. So today I'm going to join our frontline public health workers and join our healthcare workers in the D.C. area in getting vaccinated. So I'd like to now introduce you to our Chief of Fire and Emergency Medical Services in the District of Columbia, Chief Donnelly.
Thank you, Dr. Nesbitt. First, I'd like to start out by saying thank you to the mayor for giving me the opportunity to be the chief, having that confidence in me, and being here today. For all the support for the department, for the frontline workers, to you and Dr. Nesbitt, we have not run out of PPE. Our department has been there to continue to serve the visitors and the residents of the District of Columbia during this pandemic, and we will continue to be there. We believe that this vaccine is going to help us continue to do that. It is very important to us for that reason. I think the most important thing for me to say in all of that is I believe in the vaccine, and that's why I'm getting it today. I want to show all of our members, anybody in the community that may think that there's something wrong with it, it's not safe. I'm going to take it today. I think that's what the message we've heard from everybody else, and I'm actually looking forward to it. This is a great first step on our recovery. And I'm going to introduce Dr. McCarthy. Yes.
Thanks, Chief Donnelly. I'm Dr. Richard McCarthy, and I have the honor of being the medical director of the largest integrated multi-specialty medical group in the D.C., Maryland, and Virginia area, the Mid-Atlantic Permanente Medical Group. And I have the pleasure of working with Ruth Williams Brinkley to deliver the highest quality of care in the area. We're really honored to partner with the DC government to be able to vaccinate our first responders and healthcare workers. And I'd like to start by thanking all of our first responders and all of our healthcare workers for putting themselves on the line, for transforming healthcare both within and outside of Kaiser Permanente for COVID patients. I'm particularly proud at Kaiser Permanente of our virtual home care program, which allows us to take care of COVID patients at home using remote telemedicine and remote data monitoring. I'm also proud of the folks in advanced urgent care here in our 24/7 center at Cap Hill who take care of COVID and non-COVID patients every single day. And I'd like to thank in particular all of the clinical staff here and administrative staff who have made this possible, and the folks who have helped get us the opportunity and the honor to vaccinate KP and non-KP healthcare workers and first responders. I want to reiterate that the vaccine is safe and effective. We're all excited about the vaccine. Both healthcare workers and our country have been through a grueling 9 months, and this is the light at the end of the tunnel. I want to reiterate what other folks have said up here, that this is not the end. We need to continue to practice social distancing. We need to continue to use masks. We need to avoid crowds, especially during the holidays, to keep people safe. It'll be several months before we're able to achieve herd immunity, and we can say finally that COVID-19 is over. I want to introduce some frontline healthcare heroes who are going to be publicly vaccinated. But before I do that, I want to introduce an advanced care nurse, Corey Robinson, who worked for us in our advanced urgent care and now works for us in adult medicine upstairs and has come here to vaccinate all these folks publicly. So I want to give her a round of applause for agreeing to do that. So I would like to introduce first Dr. Nesbitt. Dr. Nesbitt, as you heard, she's a board-certified family practice physician with over a decade of experience leading population health initiatives in governmental public health agencies. Dr. Nesbitt has served as the Director of DC Health since January of 2015. In this role, she has reframed the discussion around health equity in Washington, D.C., and broadened the way we think about supporting health and well-being of D.C. residents. Prior to serving as the Director of D.C. Health, she served as the Director of the Louisville Metro Department of Public Health and Wellness, and I'd like to welcome her and thank her for agreeing to be publicly vaccinated here at Kaiser Permanente. The next person I'd like to introduce is registered nurse Sally Sanhu Bing. Sally is the clinical operations manager here at Capitol Hill Kaiser Permanente Medical Center for advanced urgent care. She's been a nurse for 15 years and worked for Kaiser Permanente for the last 5 years, and she helps serve all our patients downstairs in our 24/7 urgent care.
Do you have any allergies? And do
The next person I'd like to introduce is Dr. Saima Siddiqui. Dr. Saima Siddiqui is a board-certified physician, and she's also the Chief of Service for Advanced Urgent Care in the D.C. and Suburban Maryland service area, which is our largest service area. Dr. Siddiqui also works for Employee Health in Mid-Atlantic Permanente Medical Group. She's been here for 7 years and has led a lot of transformations in access to advanced urgent care, as well as working with others to achieve 24/7 virtual access within 4 or 5 hours to our doctors in advanced urgent care.
Can you tell me your date, your month, and your day of birth? January 26th. Do you have any allergies to any medication? No. And do you have back pain from needles? No. Do you have any questions about the vaccine? No. I need more blanket needles. Somebody can grab me some, and another vaccine. Yeah, the ones that came with the manufacturer don't work. But I do need that. No, so these ones aren't wide enough to cause the vaccine.
So while we're waiting, Saima, do you want to talk about some of the changes that were made by your department for COVID?
Yes, since March, we were able to get triage area set up for all patients. We were able to create screening at the doors for all of our members who walk into the building. We were able to test through drive-through testing a lot of our membership. We have also been on the front end of trying to create virtual medical care for members who could not come to the medical office buildings. So it has been a very busy last 9 months.
Yeah, and Saima and the leadership team has achieved a 24-hour turnaround time for our COVID test, which is fantastic, working with the leaders in our lab, and also amazing access in virtual care with, on average, within 4 or 5 hours. You can get a video visit or an in-person visit if you prefer with an emergency medicine or family practice doc. So thank you.
Can you bring me the red one? The red ones, pull it up better. So the vaccine is very thick, which is obviously a little bit different than what we're used to. So it's red one needles is probably the best one.
Okay.
We have some over there. So cold. So cold. Yeah.
Yeah, and I also want to thank Corey Robinson. It's hard enough to start giving vaccines, but to do so publicly is a big deal. So thank you very much.
Dr. McCarthy, what I noticed about the vaccine is it's very thick, unlike the flu vaccine or any other vaccines that we're used to giving. It's a little more thick than the normal vaccines.
So you need a different size needle to pull it out.
Right.
while we're waiting, I also want to recognize Dr. Sheetal Desai, who's the physician-in-chief for the DC and suburban Maryland service area, and Dr. Mona Gahunia, who worked with our health plan partners, Haley Park and others, to help us be first vaccinators for the District of Columbia and our other regions. So thank you both for your leadership. The next person I would like to introduce is Lieutenant Keisha Jackson. Keisha Jackson joined the Fire and EMS Department in DC in 2003 and is assigned to the department's Homeland Security Division. Welcome.
The day you were born and the day, the month and the day.
March 6th.
Okay, thank you. Do you have any questions about the vaccine?
No, not right now.
Okay, and do you have any allergies?
No.
And do you faint when you need over after vaccination?
No.
No? Okay. Which arm would you prefer, the right or the left?
The right.
The right, okay. Give me a second.
Take your time.
Oh, don't be scared. It's okay. We can both close our eyes. Don't be scared. It's okay. I hear I'm a good stick, and we can talk to it if you want. But John, just a little bit, I'm going to roll your sleeve up. Just have to open the elbows. Question? Do you want a little higher? So I should dry out for a second. You're done. You made it. It's okay. You're good. You're welcome.
Great. The next person I would like to introduce is Chief John Donnelly, who's the Fire and EMS Chief in Washington, D.C. He started his career with D.C. Fire and Emergency Medical Services in 1992 and was promoted to Chief by Mayor Bowser in September of this year. Congratulations.
Thank you.
He previously served as Assistant Chief, as the Division Commander of Special Operations, Homeland Security, and Apparatus Division, and is a member of the command staff in special projects and executive officer roles.
Chief Donnelly, did you register this morning?
Yes, I did.
Just got to find you in here.
Nope, I'm not Eric.
Nope, nope, you're not Eric. Nope. Did they give you a temporary medical record number?
No.
I'll take care of it. You'll take care of it? Okay. Do you have any allergies to any medications?
No, ma'am.
No. Okay. And do you faint with needles?
No, ma'am.
No. Do you have any questions about the vaccine?
Nope.
All right. Get the last dose in the first vial.
Ooh. It's hardly wait.
It's too thick. So I'm going to use a different vial.
Get over. Get read your picture taken so many times.
No, and I'm very hot.
He's doing very good at looking disinterested.
Thank you for your patience.
Oh, no problem at all. You're through a lot of needles. You're going through a lot of needles.
I know. Pfizer sent us a lot.
That's good.
Wow. You know, taking one in your right arm.
It's the closest one to
It's the closest,
We'll make it as easy as we can.
Appreciate you. Fine.
Don't get used to it. The mayor might.
How did you do this
Awesome.
time?
Awesome. Didn't even do it.
Muffle it, take ibuprofen, and be sent this way to register you for your second appointment.
Okay, thank you.
You're very welcome.
The next person I'd like to introduce is Dr. Robert Holman. Dr. Holman began his medical career here in D.C. He attended Georgetown University School of Medicine, completed his chief medical residency there, and then went on to a fellowship in infectious disease at the NIH. He joined the department in February of 2016. Welcome.
You're very welcome. Do you have any allergies? And are you, do you think from, no? Okay. Do you have any questions about the vaccine?
Okay.
Got it.
You did it already?
I did.
Easy. Great. Thank you so much.
You're very welcome.
Thank you. And then finally, Lieutenant Joseph Papario, who joined Fire and EMS Department in Washington, D.C. in 2003 and is an officer of Engine Company 23 in Foggy Bottom. Welcome.
Corey, are you a nurse? Any allergies? No. Maybe faint or measles? Perfect. Do you have any questions about the vaccine? No, ma'am.
Who's had the biggest flinch so far?
It's going to be you. We're making history together.
Yes, we are.
You got your arm ready for me?
Yes, ma'am.
Just try to relax a little bit. So one thing with the vaccine closer to the shoulder, there's a lot of pain, so we go a little further down, okay? 1, 2, 3. Any muscle aches? 5 years open.
Thank you.
I want to close by thanking everyone today who agreed to be publicly vaccinated, and also to give a round of applause to the Nurse of the Hour, Corey Robinson, who had to vaccinate everyone in a public setting and did a fantastic job. So thank you very much. And lastly, I want to thank all the first responders and healthcare workers, physician and staff who over the last 9 months have helped keep us safe, keep us healthy, and we're excited that the end is near with this vaccine. So thank you, everyone, and thanks everyone at Capitol Hill who made this possible. Thanks. Thank you.
Mic check 1, 2, 3, 4, 5. Mic check 1, 2, 3, 4, 5. Mic check.
Good morning, everybody. I'm Muriel Bowser. I'm joined by members of my team, and we are at Kaiser Permanente, Capitol Hill, part of Kaiser Permanente's Mid-Atlantic region. We have just completed a session with Kaiser staff and our healthcare workers. Starting with Dr. Nesbitt, the district's doctor, Chief Donnelly, and members of DC Fire and EMS. And so I'm so grateful to Kaiser for working as a partner with DOH to be among 6 first vaccinators in the district. So with that, we're available for a few questions. Yes. Go ahead, Mitch.
In your order that you issued last night, you referenced trying to seek parity in the count between restaurants and churches. So I'm wondering why not restrict restaurant capacity further and instead expand capacity for churches?
Restaurants were restricted.
Right, but churches, you expanded the capacity for churches. So why not restrict everyone and seek parity that way?
I also mentioned that we were trying to settle a lawsuit, and we're still trying to do that. And so that's what my order represents, our best way to do that.
The order also references the calculation for 250 comes from a restaurant that can hold, I assume, up to 1,000 people. Which restaurant is that?
We have a couple, I think, that are that size. Clyde's, Old Ebbitt, Hamilton.
Does this order apply to grocery stores now, and is that a new restriction?
It does, but we think it's basically current operations.
So you don't believe it will have any impact on how many people can be in a grocery store?
I don't think so, but we think it reflects current operations. Yes. Yes.
Dr. Nesbitt, could you talk about the game plan in terms of Moderna when that vaccine becomes available?
Sure. Well, pardon us. We'll do probably a little bit more shuffling here than we do normally. We are optimistic that this weekend the Moderna vaccine will receive its emergency use authorization based on preliminary data that has become available. The FDA's advisory committee will meet today, and if past this prologue, the same cadence that occurred last weekend will occur this weekend with the FDA meeting and providing its emergency use authorization, the CDC's Advisory Committee on Immunization Practices convening over the weekend, and the CDC director signing its order that provides additional detail related to how the Moderna vaccine should be used and which population should receive that vaccine. If that occurs, then jurisdictions may begin receiving doses of the Moderna vaccine next week, in addition to doses of the Pfizer vaccine that are being shipped to jurisdictions on a weekly basis moving forward. We know that the Pfizer vaccine is best used or distributed in acute care settings or settings that have the ability to meet the storage and handling requirements. And it's a lot easier to bring people to that vaccine, is the way that we describe it. Given the cold chain requirements, the fact that it has a diluent or has to be mixed, and that doses have to be used within 6 hours of mixing. Or refrigeration. So our plan is to continue to use the Pfizer vaccine in the 6 locations that it has been used now. We may use that vaccine as we activate our long-term care partnership, where residents and staff in our skilled nursing facilities may be vaccinated with the Pfizer vaccine. That will then allow us to use the Moderna vaccine in some of our long-term care facilities or acute, subacute long-term acute care facilities like Bridgepoint, which are specialty hospitals, as well as beginning to vaccinate individuals or workers in our urgent care sites, intermediate care facilities, which may not necessarily have some of those same storage capacities, and work with our partners who are going to be helping us vaccinate our home health aides. So that will be the original plan for the Moderna vaccine. As we move through phase 1A and get into phase 1B, we have even more options with the Moderna vaccine, moving it out even further into the community.
Yes.
Hi, Lex Suarez with WBDM and WDCW. You guys were mentioning Maryland and Virginia helping us out, giving us some extra doses. Do you have a timeline for exactly when we will be getting those doses and how they're going to be distributed amongst the hospitals?
Sure. So we should begin to receive the doses from Virginia as early as next week, and depending on the timing of agreements between us and Maryland, next week, the week after at the latest.
Okay. And have you guys decided yet how that's going to be divided up amongst the hospitals or where they're going to go?
Sure. So we have provided hospitals their doses for next week. It'll follow along the similar patterns that we use for this week, with hospitals that have larger staffs will receive more boxes or doses of vaccine than those who have smaller staffs. Same process.
Yes.
I'd like to ask a couple more questions to follow up on Mitch's good questions about last night's order.
Mm-hmm.
First of all, have you talked with Cardinal Gregory about the vaccine and what they're seeking? Okay. And second, can we talk more about this concept of parity? Churches where you're singing, maybe you're socializing, maybe you're spending a long time, are different from restaurants where you're taking your mask off to eat, or different from grocery stores. You know, how do we reach this idea of parity?
You're familiar, I'm sure, with the court's rulings related to churches being treated in a different way from other large gatherings, and we are trying to be as responsive to that ruling as we can. We know at the same time, I have a responsibility to DC residents to tell them what we know, and to, regardless of what courts say, to ask them to do what is good for the city, for themselves, and for the family. So I have great faith in DC Catholics. I'm one of them, and I know that they know that we can celebrate Christmas together as usual next year. But this year is not the year to pack churches full of people. And so as we have done throughout the response to this pandemic, and as the vast majority of parishioners and churches have obliged, including the Archdiocese, we are asking people to the best extent that they can to celebrate virtually. Yes.
Can I follow up also on the mayor's order in
try to get some clarification, because it does seem, I thought retail was at 50% and now is at 25%.
That's correct.
So that would be a change, right? So you've reduced the capacity for retail, and it appears that you're including staff as part of capacity for these venues as well, for restaurants and whatnot. Is that correct?
I think that's correct, but let me get some clarification on that.
It does seem like this is a change. This isn't.
It is a change.
Okay, well, you had said this is normal. This is the same operating procedures at grocery stores.
I'm saying I think that there will be effectively little difference in how the experience that staff or customers will have based on how people are attending these venues now.
What was the capacity limit for grocery stores prior to this mayor's order? Was it already at 25%?
I think it was 25 or 50.
So you have reduced the capacity for all of these venues.
I've said that.
Okay, well, I just want to be clear because...
Well, I was clear.
Okay, so why? I guess, people are seeing...
We're going into a phase in this pandemic, Mark, where we see increased cases throughout the city. We see increased cases throughout the region. And we are increasingly mindful of people needing to reduce their activity. And there may be more that we ask residents to do in the coming days. So while we are both reacting to a lawsuit that has been filed against us, where we think the church seemingly is seeking to have at least 1,000 or more people in a venue. We don't think that's a good idea, and we're going to discourage people from doing that. But we also know that there are other activities in the city that we were going to discourage people from doing at the same level that they've been doing it.
And if I could ask Dr. Nesbitt, following up on the allotments, do you know yet what the next allotment from the federal government will be, how many doses you're anticipating, and when that would come?
Sure. So just for permanency, we will, whenever we receive vaccines, it's always going to be like it was. We expect that it will always be as it was this week. If anything changes, we'll let you know. So we'll get vaccine Mondays through Wednesdays. And from a logistics perspective, Operation Warp Speed needs to do that because they're moving vaccine to over 1,000, over 1,500 different sites across the country. So we can't receive all of our vaccine on Mondays. That's just not going to happen. We have been notified, and we will not get a number for weeks. So when you hear other jurisdictions saying that we're going to vaccinate X number of people by the end of January, they are estimating that. That is not a firm number. So the district has decided that we're not going to give you an estimate or a firm number. We want to underpromise and overdeliver. So I'm not going to get boxed into that type of scenario. What those other jurisdictions are doing is in the system in which our vaccine numbers become available, there are two columns. One is an estimate of what you may get that you get for planning purposes. So those states that are putting a number out there, that's the number they get for planning purposes. We are only operating under the number that once it becomes permanent, which is our production number. Because again, we're going to underpromise and overdeliver here in Washington, D.C. Our number that we have for next week is 4,875 doses. However, you all know that we have received a commitment from Virginia and a commitment from Maryland to have doses transferred to us. So we will have more vaccine available in D.C. next week than we have this current week because of that transfer from the other states. But the federal number we will receive is 4,875 doses.
Yes.
Another vaccine question for Dr. Nesbitt. Please, just some clarity. The district currently has residents of nursing homes and long-term care facilities in the 1B group. I'm curious if that is going to change at all. I believe the CDC's recommendation is for them to be further up the list.
Sure. So you'll recall that the plan that we posted is a draft that was done before the Advisory Committee on Immunization Practices met. And we've asked people to recognize when we posted that plan that it is a draft that was subject to change in terms of our priorities after the ACIP meets. And as the ACIP meets and makes recommendations in terms of prioritizations, our priorities will change. We also ask people to recognize that how we prioritize groups is subject to change based on the availability of vaccine. We did not begin vaccinating long-term care residents this week as some other states did, because in order to do that, we have to divert at least 50% of our vaccines into that long-term care partnership. We would not have been able to do what we're doing here today if we moved at least 50% of the 6,825 doses of vaccine into that partnership. Because we're getting vaccine from Virginia, and now Maryland has committed to do the same, we will be able to activate that long-term care partnership to begin vaccinating residents and staff of long-term care facilities, beginning with skilled nursing facilities. Once we activate that partnership, however, which we did this week, the actual vaccinations don't begin for about 2 weeks because some logistics and planning needs to happen. So we are able to divert some of our vaccine allocation into that process.
So in other words, they're moved up into the one, that group of people is moved into the 1A phase?
That is correct. That is correct. But they won't start getting vaccinated until some of the logistics that have to happen with the partners who are CVS and Walgreens is underway.
Follow-up for Mayor Bowser on the order. If you could, does the order resolve the lawsuit now? Have they agreed to dismiss the item?
They have not.
Do you expect that to happen? Or you're
I don't know.
Well, I was just hoping to talk to you, Chief, afterward outside, but can you just share with us how the process went for you? I didn't hear you cry. Everything go okay? How you feel?
I feel great. It felt like a very minor shot. And the process was smooth. It was fine. The questions are easy. I signed up for the vaccine tracking online so that I can get I can give feedback, and that everybody can track the symptoms. So everybody will know about it and know that it's safe.
Thank you. Can I just follow up real quick? We hear so much about how cold it has to be kept. Does it feel cold going in? Is that a stupid question, Doctor? I'm just wondering.
I don't think it's a stupid question, but no, it was not cold.
Feel the cold.
No.
We've heard so much from Lieutenant Jackson. Could we just hear from her? I'm sorry to keep putting you on the spot, Lieutenant, but you pointed up at the time that you got your shot, and we've all heard about your story and coming forward. Can you tell us about that moment?
That moment was, again, just thinking about praying. It was a prayer. I didn't sleep much last night. Again, it's just about having faith. I didn't ask to be the poster child. I just hope that from looking at me or sharing my story, it's your choice, and that's what I've always said. It's your choice. It's your choice if you want to make things better. For me, it was the best choice. I can't force you or tell everyone, get the vaccination. I understand there's a lot of apprehension, especially when it comes to my community and my people. I understand. But it's my choice, and I had to do what's best for my family. So just overwhelmed, and that's where the tears came from. Just overwhelmed, thinking about, again, just praying and having the faith to know everything is going to go well. I've got a lot of negative feedback and positive feedback, and it hurts. It does. You find out who your friends are. You find out who will support you through the storms and through the sunshine. And I have definitely experienced that, even from my coworkers who I've been on this job almost 18 years. And it just gives you such eye-opening how people really feel about you, despite of why you're doing this. And I am doing it for what I said was my truth, and I stand by that. So if I get a unicorn horn next week, then I will wear that proudly. But if it saves, my people and what's going on, then that's how I feel. This is just my truth. It's not me trying to, again, be a poster child for anybody. This is just what I want to do. It's what my heart tells me to do. And I've been following my heart all this time, even with this job. It hasn't failed me yet, and neither has my God.
Amen.
So.
All right, thank you. Thank you.